The parliamentary status of the measure is that we're still in the period of interpellation. So may we recognize the sponsor of the measure, Senator Cayetano, and to continue interpellation, the majority leader, Mr. President.
Senators Cayetano and Senator Sotto are recognized.
Mr. President, I'm just putting together my files, but His Honor may proceed.
Thank you. Mr. President, last September 20, 2011, I requested for the copy of the report from the committee that states that there are 500,000 induced abortions as manifested by the sponsor on the floor. May we know if we already have the data, if it's already available, Mr. President?
I regret that I don't recall that there was a specific request for data. If I'm not mistaken, we simply gave the source, because that is what we have, the source of that data, that there is abortion, and we put that on record the last time. Let me just check again to repeat that source.
Yes, we were asking for the source and how the numbers were arrived at and how it was obtained. If you will recall, and I will read into the records our interpellation during that time, I quote Senator Sotto, Mr. President, just before I reply to that, may I know where the distinguished sponsor got the 500,000 figures of abortions? Senator Cayetano, allow my staff to... That is a figure that I have often mentioned. This is not the first time I have mentioned it. Senator Sotto, yes. Senator Cayetano. So let me give the gentleman the source in a few minutes. If he has other questions, I will give it to him as soon as my staff looks it up. Senator Sotto, well, that is a better question, but let me find out now as the sponsor staff is looking for it. How many of these 500,000 abortions are spontaneous abortions and how many are induced abortions? Answer, Senator Cayetano, the 500,000 are all induced abortions. Mr. President, go to Baclaran, have the gentleman staff go there, and any one of us have them walk there, and we will see how many people in front of Baclaran Church are selling herbal remedies, etc., etc. So, that is the reason we would like to recall and ask for the source and the data if it is already available now, Mr. President.
The intention is to, yung sinasabi nga kung ipalaglag yung bata, no? So that we confirm, and I ask for the indulgence of the majority floor leader as we once more go through the records. I apologize that I was not able to give him whatever data we have. So if His Honor would continue, I will let you know what we have by the time we you know, within the next few minutes, just so we don't have to wait.
Well,
Mr. President, let me give you now one of the sources. No, the reason I apparently did not have it on mine is because that information came from the speech of Senator Miriam. Although we do have a database, so it just took a while to get it. The data that we have is that the number of intended pregnancies which resulted in induced abortion dated 2008 is actually 570,000, and the source cited is the 2008 Guttmacher Institute study of pregnant Filipinas. Now, let me now get a copy of this study so that we can provide further information, because this is just a pretty much a footnote, not pointing to the source of that data. And just to complete the record, I also have statistics similarly from the Guttmacher Institute. It's an earlier study, 1994, and the figures are at around 400,000 plus. So that is what I have for now, and I would be happy to look at the study itself and give more details. If we have it, then I can put it on record as we go along.
Yes. Okay. We will accept that in the meantime, Mr. President, but we will still await the data available when it's available.
Yes.
I will go to that particular issue and the Alan Guttmacher Institute research study at a later time, Mr. President, probably later on. Let me start off on how so that there would be order in my interpellation. I was hoping to get these statistics that were asked for some time back. Now, the other one is that also in one of our interpellations, you mentioned that the implementation of the RH bill, as to my question, in response to my question, was to the distribution of contraceptives or condoms is better asked with the DOH. You said something to that effect. You said that you will ask the DOH on this. Can we already be furnished with these documents or guidelines from the DOH on whether they distribute condoms or contraceptives in the past so many years, Mr. President? You will be satisfied with last year.
Mr. President, there used to be funding for the distribution of condoms, but this was phased out in 2004. So after that date, the only distribution they had, which was at a very low level compared to when they still had donations, was for the control of HIV/AIDS. So that was the limitation. And then I imagine that certain LGUs also took it upon themselves, no? Maybe there are also some NGOs, but this is no longer in direct coordination and under the supervision of the Department of Health.
Okay. I will leave that particular issue to Senator Lacson. The issue of condoms against HIV/AIDS, I think he has a very important data concerning that. Let me move on to another part, and let me start off from this on our interpellation today. In our other interpellation day, September 12th, the distinguished lady, the good sponsor, furnished us with the list of the NGOs pushing for the passage of the RH bill. And if you will recall, during my past interpellations, I questioned the involvement of some of these organizations on abortion activities. Again, just for the record, let me rub it in. As I said before, if this measure is just being pushed by the distinguished sponsor or Senator Miriam, then we would probably have not too much of a difficulty. But finding out the people behind these particular measure, much to be desired on finding out more about them and who they are, how they started, who's behind all this, what is the money behind this, especially in the funding that is being received by this organization. So, as I said, I questioned then the involvement of these organizations on abortion activities, such as the FPOP's website, the Family Planning Organization of the Philippines, being linked to abortion. It is linked to abortion clinics in the Philippines. If you click what we have, it will lead you to that, as seen on the screen. And then Dr. Melgar of Likhaan, I showed you the video, clearly pointed out an interview that, quote, if you really are pro-women, you will have contacts to these services that are underground. And in the preceding statements, she was referring to abortion service providers. I also showed in a PowerPoint presentation, which is a proposal to the United Nations Population Fund by the Likhaan for its affiliate, Reproductive Health Advocacy Network, the ARHAN, asking for monetary support in order to expedite the passage of the RH bill. Part of the proposal includes a budget item which you will read as nurturing legislators, which until now I haven't received an answer as to what does it mean. I remember distinctly asking the distinguished lady on what they mean by nurturing legislators and who are the legislators that are being nurtured. Does this include senators, Madam President, Mr. President, and Your Honor?
Would this honor allow me to reply now on
yes,
that
please,
issue?
yes.
Thank you. Dr. Junice Melgar is sometimes here, but apparently I'm told that she's in the House now, in the lower house, also for the RH debates, no? And my staff informs me that when this question was asked, there was a discussion shortly after. And I recall that the explanation one was that there actually is zero budget for this, but that it includes their expenses for coming here and being present here and whatever other expense they incur in attending the proceedings. That is the discussion that was relayed to me, the explanation that was relayed to me.
But what you see here, what we're presenting on the screen, is part of their budget item. It's part of their statement. It's part of their website, as a matter of fact. And number one is nurturing of legislators. I was hoping to be enlightened by what they mean by nurturing of legislators.
Well,
sorry.
Yes, go ahead.
Because if you will continue, the next item, no. It says development, production, and dissemination of information segregated into target audiences, legislators, media and professionals, communities. Then, mobilizations, 2 nationally coordinated high-profile mobs. I don't know what they mean by mobs. March and September. Regional mobilizations outside NCR. 1 each in Luzon, Visayas, Mindanao between April to September. Other sectoral and local action will be funded independently of the UNFPA budget. It is the United Nations Population Fund, the UNFPA. So, how can there be no budget to this, Madam President?
No, actually,
They are not giving you accurate information, if that's the case, Madam President. Mr. President.
Okay. Mr. President, allow me to clarify. My staff just informed me. When I was told that there is no budget in terms of providing funding of whatever nature to legislators. But they have budget for the expenses that they incur for their mobilization to come to the Senate, to come to the House, to as His Honor mentioned, the mobs, which is a short abbreviation for mobilization, I assume incurring expenses. So those are the budgeted items that they have. I mean, I would imagine I've participated myself in quite a few events, and you get transportation, you pay your staff, you feed people. So I'm speaking from experience in just mobilizing my own events. Like I said, the Arhan representative is not here, so I don't have first-hand information from their organization.
So the sponsor believes that the phrase nurturing of legislators in their budget item does not mean funding.
Of legislators?
Of legislators, no.
Well, I can only speak for myself, and definitely I've not received any kind of funding whatsoever from anyone at any time of ever since I've become a senator with respect to any lobbying of any bill. I'm quite certain my co-sponsor, Senator Miriam, has not either. And I can only speak for that.
I'm sure of that.
And then,
I will even vouch for that.
And then their word that their word also from the group that there is no budget in terms of that connotation that funding was given to legislators. That is what we were told when His Honor first brought up the issue.
Okay, but again, forgive me, Your Honor, I'm still not clarified with what they mean by nurturing. Anyway, let me leave it at that because according to you, the Arhan representative is not here to help you.
Mr. President, my staff handed me her cell phone, and there is a text from Dr. Junis, and it says here, if they would have read the proposal, they would see that nurturing legislators means transportation of community leaders to talk with legislators, 80,000. So I guess it's consistent with the explanation I gave earlier. It's the expenses revolving the, I would guess then it's then a connection of 1, 2, and 3.
So,
and this is coming from Dr. Junis
so
herself.
nurturing would be what? Talking to them?
Well, the text said the expenses of the community leaders to, what's the word, talk? To talk to legislators.
Well, my next question is not addressed to the sponsor. My next question is addressed to myself. Why quotation marks on nurturing, and why do you use the word nurturing instead of talking to legislators or something else that would not be misinterpreted? I'm asking myself, I don't know, I would not have used the word nurturing of legislators.
It's a term that they use for babies. That's all I can say.
Thank you. Yes, I know. That's why.
That's only because I have a toddler and I use the word nurturing all the time.
Yes, I know. And, wala namang baby sa Kongreso at sa Senado, Mr. President. Anyway, then what I did was come up with some further background investigations on these organizations backing up the RH bill. And I found out that some of them have revoked SEC registration. Others have not been registered with the SEC. These are the list that the committee has given me. Source persons attending hearings, expressed support for the RH bill, and are vigorously pushing for it. As a matter of fact, we have Magdalena Bacalando, President of Pinagsamang Lakas ng Kababaihan at Kabataan. Securities and Exchange Commission status not found. Dr. Edwin Ilaga, National Program Coordinator for Adolescent, Reproductive, and Sexual Health, does not exist. Save the Children Federation Incorporated, it's a foreign stock. Elizabeth Angsioco, Chairperson, Democratic Socialist Women of the Philippines, does not exist. Dr. Edelina de la Paz, Executive Director, Health Action Information Network, registered with 2010 financial statement. Roberto M. Ador, President, Family Planning Organization of the Philippines, registered with 2010 financial statement. That was where we got the $617,000 that they received from the International Planned Parenthood. Benjamin De Leon, President, the Forum for Family Planning and Development Incorporated, registered with 2010 financial statement. Ramon San Pascual, Executive Director, Philippine Legislators Committee on Population and Development, PLCPD. As a matter of fact, I think Santos Dero is a member. Revoked. Marlon Laksamana, HIV/AIDS Network, revoked. Dr. Junis L. Melgar, President, Linangan ng Kababaihan Incorporated, or Likhaan, revoked. Supposed to be, she is Secretary General of the Reproductive Health Advocacy Network, the ARHAN, no records. And then Corazon Raimundo, PhD, Executive Director, Institute of Maternal and Child Health, does not exist. Madam President, may we know if the good sponsor is aware of this information?
Mr. President, most of the organizations His Honor mentioned are simply organizations of, some are very, ordinary people, women. Some of them are professionals who work with communities. Many of them, in fact, are not registered. They do not have a juridical personality, Mr. President. And they identify themselves because of their common goals, and they form a network to support and do a lot of things together. Now, I humbly submit that their juridical personality is irrelevant in this discussion because they have no specific responsibilities identified in the bill. We do not create any position for them. We do not impose any obligation on them. We do not demand that they perform certain functions. They are simply most of them are simply ordinary citizens who have chosen to organize themselves to support a common goal. Now, as for those that have SEC registrations, well, that is their lookout, but as far as I'm concerned, as chairman of the committees that are sponsoring this measure, it is irrelevant to this measure. I do not rely on them to implement this law. I do not impose on them any obligation, and therefore they could disappear, and it would not matter to the to my committee and to my sponsorship of this measure.
Well, Mr. President, if they have no personality, how can we determine if they're legitimate or not? But the reason
it doesn't matter, Mr. President.
Yes,
that is the point I'm making.
All right, thank you for that. But we have received reports that they are receiving financial subsidies from foreign organizations.
But Mr. President, even sorry.
The reason I verified these organizations, whether they're registered with the Securities and Exchange Commission or not, is to determine if we could have access to their financial statements. Because of just today, if you will recall the big item on the Philippine Daily Inquirer about the $50 million lobby being used to support and they pass the RH bill, not only in the Philippines, but also other countries where abortion is illegal. So, I believe the Securities and Exchange Commission, they require all registered organizations, whether partnership or corporation, to submit their financial statements periodically. We were hoping that we can check on these organizations. But if they are revoked or non-existent, they are clearly avoiding something. Even government probably, we cannot review their transactions. I am very much interested in looking at the financial statements of these organizations because, as I've said, we have received reports that they are receiving financial subsidies from these other foreign organizations, particularly those foreign organizations whose main thrust is to legalize abortion in countries where abortion is still a crime. And they aim to do this through the help of non-government organizations.
Mr. President,
we have a law against foreign funding of our laws. Nakikialam sila sa paggawa ng batas dito sa atin eh. Hindi mo ba dapat alamin natin kung sino sila? So, reportedly, if I may continue, that's the reason why I'm bringing this up. $90,000 was given by the United Nations Population Fund to the ARHAN, Reproductive Health Advocacy Network, for promotion. And $617,000 to the Planned Parenthood arm of the Family Planning Organization of the Philippines. 1.6 million from 2005 to 2009 $1.2 million to PSPI from Mary Stopes, $39,000 to Likhaan from the Planned Parenthood Federation also, $88,000 to FPOP in 2009 from Mary Stopes for RH Kits, and $75,000 to Catholics for Choice to promote RH from the Wallace Global Fund. We might also have to check from their financial statements if they have been doing this nurturing legislators to the past Congresses, and not only now, because they have been here since time immemorial, probably since the 8th Congress. So, before I move on to another topic, I have noticed, and I would want to place it on record, that majority of the organizations backing up the RH bill either not registered with the SEC or have revoked registrations. So if these organizations cannot comply with the simple registration or financial reporting requirement, how much worse can they be in following instructions stated in the bill? Especially when it comes to the issue of post-complication abortion. Baka hindi sumunod sa mga gawain na ganun yun.
Mr. President, if I may be allowed to respond before
Yes,
His
please.
Honor continues, because His Honor raises very valid points. I'd like to be very clear about this, that as a sponsor of this measure, and I will speak for my co-sponsor as well, Senator Miriam Defensor Santiago, we would not want to be part in any illegal activity. And thus we would like to know from His Honor what law exactly is being violated, because what I am aware of is that definitely a public servant should not be receiving any bribes, and we should not be accepting any funding, like His Honor says, from international sources. So when His Honor refers to organizations and advocates who and questions their funding, in what way does that affect the work that we are doing in the session hall? Because we definitely would like to be guided.
Thank you, Mr. President, for the question. Republic Act 1827, they're violating that. An act to regulate lobbying in Congress or of the Philippines and in Commission of Appointments. Section 2, corrupt means to influence legislation, disclosure of interest. Any person who shall directly or indirectly give or agree or offer to give any money or property or valuable thing or any security therefore to any person for the service of such person or any other person procuring the passage or defeat of any measure before the Congress of the Philippines for either house, etc., etc., Mr. President. Republic Act 1827. They are trying to influence us in passing the RH bill.
Mr. President, if I understood His Honor's reading of the law, it refers to a lobby group who is trying to persuade, and as a word used is lobby, by using funds, and that presupposes that a senator or a legislator was approached. So that is where I draw the line, because His Honor himself says that he has no doubts as to these representations not being part of anything, and that is what the law refers to. So I still do not understand what law His Honor is concerned, what provision of law His Honor is concerned as to the funding being received by other groups. As far as I'm concerned, there is no law being violated when they profess their views, when they go about their activities and are not violating any law. That is what makes, when we say a law is violated, we have to specify what that law is. And the law that His Honor mentioned refers to a public official receiving an attempt to give a bribe and to influence a public official through funding or other material means, and that is not the case, as His Honor very well has mentioned himself. So if we are just referring to the funding of the organization, I'm not aware of. Again, I would like to be enlightened. What law do they violate?
Again, Republic Act 1827, because it doesn't only speak about funding, it also says persuading. So, and then let us probably have to visit Batas ang Pambansa 39. Why don't we do that also? an act regulating the activities and requiring the registration of foreign agents in the Philippines?
Well, Mr. President, I have absolutely no objections to His Honor pursuing the identities of this group and determining where their fund comes from. But so far, I do not see again how it affects this measure, because this committee and the Senate as a body and Congress as a whole does not receive any funding from them. They, as any ordinary Filipino is allowed to do, can come and see us and discuss their concerns with us. They can see us every day if they want to. There is nothing wrong with that. As long as we do not receive any material, funding, financing from them, there is no law violated. So that is just a position I want to make. His Honor is free to investigate their activities, to find out if they are involved in any illegal activities. But so far as my job is concerned, which is to defend the RH bill and their desire to support it, there is no law being violated there, regardless of who they are affiliated with.
Well, anyway, that is your perspective, and
no, Mr. President,
we were just asking now.
Well, no, Mr. President, I just like to put on record, I don't think it is a matter of perspective, because if we're speaking of violating the law, that is a very strong accusation, and that involves my work in my committee. So to the extent that I need to clarify that no laws are being violated as I defend this bill, I will not allow that there be a question as to whether in fact there are, because there are none. There are none. Now, if His Honor would simply like to put on record that some supporters are questionable, then that I can accept. But it has nothing to do with the legality of this measure and how I, as a sponsor and the committee, is pursuing this measure. It does not affect the legitimacy of this measure.
Mr. President, the distinguished lady was the one who brought up the issue of legality. I was just questioning their motives. No, I don't care if they're doing it legally or illegally. Really, we could do it that way. But nevertheless, as I said, I pointed out the laws that these groups are probably violating. And they are the ones providing for information and statistics to our committee. Sila tapos mga nasa likod nila, sino-sino. Pero sila nagbibigay ng informasyon at statistics sa atin Oh, hindi ba dapat imbestigahan natin sila? That brings me to one of the points that I was hoping to avoid, but because of this issue, let me go to it now. In your one of your sponsorship, in one of our interpellations, Your Honor, Madam President, I asked you what the participation or what kind of support, if any, did the IPPF, International Planned Parenthood Federation, provide in order to create this bill. The same with the Family Planning Organization of the Philippines. You told us that you will check all the public hearings where FPOP attended and up to what extent is their participation in the creation of the RH bill.
Mr. President, may I ask His Honor if I may reply now?
Yes.
Yes, thank you. I thought I had answered that question. I had mentioned that FOPC, in fact, was present in our hearings along with many other other organizations, and I had also put on record that they are affiliated with IPPF. And I had also put on record that, as His Honor correctly pointed out, IPPF does include abortion as one of their family planning methods. And I may or may not have said it at that point earlier, so I will say it now. If you look at the records of IPPF, abortion is in fact one of the, how do you say it, the least used or utilized form of family planning, even in other countries where IPPF operates. But more importantly, it is part of IPPF's guiding principles or their mandate that they will not, and I repeat, they will not support abortions in countries where it is disallowed. Therefore, Mr. President, the affiliation of the FPOP, the affiliation of FPOP with this organization does not in any way support abortion, because that line has been drawn. The international organization already makes that statement that it will not intervene, it will not get involved in abortion in jurisdictions, in countries where it's not allowed. And I cannot say anything more than that, because the fact is I simply read their statements and I am not their advocate. I am just repeating what I understand of their of the way they operate.
Yes, I'm glad you said that, and that you were just hearing what comes from them, and it's not just that. May I quote from a statement of the FPOP? This is one of the... let me quote the statement so it will directly answer your point.
Please.
They say, "We do not intend to hide the fact that FPOP provides abortion-related services aside from our main service components on access to family planning and reproductive health services, young people's sexual and reproductive health, HIV and AIDS, and advocacy." The letter was addressed to the media, and it was actually trying to educate me. They say, for the education of Mr. Sotto and for the satisfaction of our countless support, etc., etc. Let me go to that now, Madam President. This is one of the organizations actively pushing for the RH bill. It's a family planning organization of the Philippines. In its media statement entitled "On Senator Sotto's Abortion Bogey and the Role of IPPF and FPOP," it claims that it is not just a proud member, but a very proud member of IPPF, International Planned Parenthood Federation. Margaret Sanger's name was mentioned in their media statement. According to FPOP, Margaret Sanger is recognized as one of the leading figures in the struggle for women's emancipation and of sexual and reproductive health and rights. I would like now, Mr. President, Madam President, to present to you the facts about the International Planned Parenthood Federation and Margaret Sanger, according to our research. Let me mention also, we need to know the philosophy of the founder, to know the purpose of the organization. The International Planned Parenthood. Let me start my discussion on the International Planned Parenthood by quoting its vision, which can readily be found in its website. It says, quote, "We believe that a woman has the right to choose and access safe abortion services, and we advocate for changes in legislation to support this." That explains why gusto nilang pumasok doon sa mga bansa na walang abortion, at illegal ang abortion. IPPF has made an important commitment to scale up our work on abortion. The first step is to initiate discussion to help remove stigma, as well as cultural and religious prejudices against abortion. IPPF was founded by Margaret Sanger. The three major thrusts of her work are reflected in today's IPPF's program throughout the world. These three thrusts are: 1. Free sex, 2. Eugenics, 3. Birth control. Free sex. Let's look first at Sanger's ideas about sex. In the years before Sanger opened her first clinic, she would attend intellectual discussion sessions at the home of Mabel Dodge in New York City. Mabel Dodge described Sanger as, quote, the first person I ever knew who was openly an ardent propagandist for the joys of the flesh. Sanger expressed her own desire for sexual activity through the numerous extramarital sexual partners she took, relationships which were documented by all of her biographers. To illustrate, Madam President, the extent of Sanger's emphasis on free sex, Madeleine Gray, in her 1970 book titled Margaret Sanger, tells of a letter Sanger sent her 16-year-old granddaughter, extolling the value of sex and stating, kissing, petting, and even intercourse are all right as long as they are sincere. I have never given a kiss in my life that wasn't sincere. As for intercourse, I'd say 3 times a day was about right. This acceptance of extramarital sex and even sex among teenagers is characteristics of IPPF's so-called sex education programs. IPPF sees nothing wrong with children having sex. It has only a problem when that sex results in the birth of a child. Sanger brought this philosophy to IPPF. As Madeleine Gray points out in her book, quote, undoubtedly, one reason for Sanger's interest in birth control was its connection with sex. She enjoyed sex so much that she wanted all women to enjoy it too, without having to bear children they didn't want. Now, on the issue of birth control allowed Sanger to engage in the joys of the flesh without the fear of having children. In addition, she saw it as a way to reduce family size. Sanger, in her book entitled Woman and the New Race, stated, quote, the most serious evil of our times is that of encouraging the bringing into the world of large families. The immorality of large families. The immorality of large families lies not only in their injury to the members of those families, but in their injury to society. Now, Madam President, from the very beginning, the IPPF was pro-abortion. Its founder, Margaret Sanger, in her first pamphlet, listed the methods of birth control, among which she included abortion. She first advised women to take quinine pills to disturb the uterine lining to prevent implantation, and then said specifically, quote, it takes quinine from 4 to 6 days to bring about the desired results, and if one finds a longer time has elapsed and the flow is not brought on, then the only remedy is a surgical abortion. Never allow a pregnancy to run over a month, she says. If you're going to have an abortion, make up your mind to do it in the first stages and have it done. Sanger was so intent in reducing family size that she seemed to not stop even at abortion. Many believe that under the right circumstances, Sanger would have condoned infanticide. Indeed, she wrote in her book, Woman and the New Race, quote, the most merciful thing that a large family does to one of its infant members is to kill it. End of quote. This comes from the woman who formed the philosophical base of the International Planned Parenthood Federation. So, Madam President, you can see that Sanger was a woman who enjoyed the joys of the flesh and felt sex was something to be engaged in regardless of marital status. You can see that her interest in birth control, not just due to some humane concern for the health of women, which birth control doesn't help anyway, but was driven in part by her desire to encourage women to engage in sex without having children. Most of us know about the part 2 of Margaret Sanger, the issue of eugenics. I will just submit for the records of the Senate her eugenics, the application of the laws of hereditary to physical and mental improvement, especially of the human race. It's quite lengthy, Madam President. Let me just quote some of her own words. This Margaret Sanger, founder of the Planned Parenthood, Mr. President.
Madam President, with the permission of the two senators.
Senator Estrada, Senate President Pro Tempore is recognized.
Just like to ask the Majority Leader, is Margaret Sanger still alive?
No, Mr. President. Fortunately, she has already found her judgment day, and I'm sure she is warmly received down below.
I should have known her during her younger days. As for the definition of Margaret Sanger, in her definition of free sex, can you just kissing, petting, and even intercourse are all right as long as they are sincere. In my my analysis in her definition of free sex is that she is kissing or even giving intercourse not with her husband. Am I correct?
Oh, yes, 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 you're right.
So she does not value marriage?
Not at all, Madam President. As a matter of fact, I was about to read into the records her stand on marital sex. She says, the marriage bed is the most degenerating influence in the social order. It's quite the opposite of God's view in the Bible, because Hebrews 13 says, marriage is honorable in all, and the bed undefiled, but whoremongers and adulterers God will judge. She is the reverse. Well, I'm not surprised, Mr. President, Madam President, because Margaret Sanger was an atheist.
Because for me, if she does not recognize the marriage, because for me marriage is an institution, it runs counter to the culture of Filipinos. Because for me, I only have one wife. Why am I hearing some snickering over there? Para ayaw maniwala.
Your wife is calling, Mr. President.
I think so. Well, this only solidifies my stand, Mr. President, on my stand against or for RH bill, because this is only the first time that I saw this presentation of the Majority Leader. That's why I wanted to. That's why I relinquished the chair to Senator Legarda, for me to have more insights of what is really happening in this in the debates of the RH bill. Thank you very much, Madam President.
Mr. President, if I may, I will request that His Honor, the Senate President Pro Temp, will indulge me with a little time to explain. And I also wanted for this to be considered my brief reply to the discussion that the Majority Floor Leader put on the floor on Margaret Sanger, on IPPF. Mr. President, I ask my colleagues, where in this bill does Margaret Sanger appear? Where in this bill does IPPF appear? We have made it very clear from the start that this is the responsibility of the Department of Health. There is nothing in the bill that imposes obligations on any entity mentioned earlier by the Senate Majority Floor Leader, and neither do we single out the IPPF. And I will wait for His Honor to finish his phone call, because I certainly would still hope that he would hear out the RH position on this matter. I will continue. Yes, as I said earlier, I would beg the indulgence of the Senate President Pro Tem that nothing in this bill gives any responsibility, gives any authority, doesn't even mention IPPF. It is a non-entity in this bill. It doesn't exist. The fact that we look at all the studies as to those who are very anti-abortion, as to those who believe in natural family planning, as to those who believe in artificial family planning. All of these are matters that a responsible senator, and for that matter, a committee chair, should look into. But to associate personal beliefs of a person and an organization with this bill is taking it too far, Mr. President. We are definitely taking a position right now that Margaret Sanger and IPPF have nothing to do with this bill. Now, just in case there are any illusions as to the role of any NGO, at most, the bill refers to the Department of Health carrying on its activities in coordination with NGOs. And we do that in all measures, Mr. President. This is not new. Study all the measures that we've passed in the Senate. In many cases, especially in environment, in health, in social services, we work with NGOs. Well, then we task DOH to ban any organization that is working inconsistent with the laws of the Philippines. It is so simple, Mr. President. But I beg His Honor not to mislead the public by making it appear that this measure is about one woman and her personal sexual views. And neither is it about one organization and their views, which, if I may clarify and put on record, views that are accepted in other parts of the world. Baka ho, hindi natin alam na ilan ho lang tayo sa mga bansang hindi tumatanggap ng abortion. So hindi ho natin tinatanggap yan, pero tinatanggap po sa ibang bansa. Legitimate po yan sa ibang bansa. So by putting on record their views on abortion in other countries is irrelevant to us, because we are not trying to amend the abortion laws. We are not trying to introduce legislation that will accept abortion. Time and again, I have said that this bill will not promote abortion. In fact, it provides very strong mechanisms which will result in less abortions, because when families plan, when young girls are not getting pregnant, are not getting raped, then they will not get pregnant, and they will not put themselves in a position where they are tempted to have an abortion, as it is happening right now, Mr. President. So that is the situation, my friends, my colleagues. I can be patient and listen to the history and the sexual preferences of any person you'd like to put on the floor, but please, do not affiliate these persons with my bill, because these persons have no relation to the reproductive health bill. And we are deceiving the public if we are saying that this is what the reproductive health bill is all about. There is no connection, Mr. President. And I am just being fair and patient by allowing His Honor to talk about anything that he feels is necessary to discuss. But I will put my foot down and say, please, do not give the impression that there is a relation to this bill, because there is none. For that matter, a murderer can come here and say they support contraceptive rights. They can say they support natural contraception, but it has nothing to do with who they are. And I draw the line Because I will put on record that despite the presence of many NGOs, the information that we will rely on are those that come from DOH scientific and academic institutions. And I rest my case, Mr. President. Thank you for your time.
Madam President, it is very clear. Their participation in the bill is very clear. How can they be not? The IPPF is even funding the FPOP, the Family Planning Organization of the Philippines. The Family Planning Organization of the Philippines is a partner of the DOH. And they even admitted in their letter attacking me. It's all there, it's clear, Mr. President. That's why we're looking at the personalities behind them. What is their philosophy? The philosophy of their founder. What's wrong with putting it on record? The philosophy of their founder. Who is their founder? Who are these groups behind it? Kailangan ito, Madam President, for us to make an intelligent vote, we have to find out ba't gusto natin takpan kung sino-sino ito. Huwag natin pagtakpan. Labas natin kung sino ito mga ito.
Wala akong nagtatakip, Mr. President. That's why I am just clarifying, and I also said that His Honor is more than welcome to investigate as much, but I will stand my ground that they have no specific role in this bill. Yun lang naman po ang akin eh.
Of course,
His Honor can point out whatever. I mean, for all I know, they may be doing things that I am not aware of. But what I am saying, Mr. President, is they have no role in this bill. And the Department of Health representative is here, and she tells us that they have no specific project going on with them. And if in the future I think we need not even write it into the measure, DOH is duty-bound not to work with any organization that will commit crimes. And if they will be, what is the word, committing abortions? Committing abortions, that is a crime. And they will be responsible for that, and that is not allowed in our country. So, again, His Honor is very welcome to question the credibility of these organizations. But again, may His Honor value me with the recognition that they are not a part of this bill, Mr. President.
I agree, they are not in the bill, they are not found in the bill, but they are pushing for the bill.
But Mr. President, a murderer could push for this bill. An anarchist could push for this bill.
Then we should not pass it if a murderer is pushing for this bill.
Mr. President, a child molester could be pushing for this bill. A rapist could be pushing for this bill.
We should not pass the bill. They are murderers are pushing for. Abortionists are pushing for the bill. They are abortionists. The International Blood
Madam President, I think with the permission of the two senators, Senator Coco Pimentel.
Yes, we'd be happy to
recognize.
Yes,
thank you. Senator Pimentel is recognized.
Thank you, gentle lady and gentlemen. Well, the A word has been mentioned, and actually, on reading this bill, what struck me was Section 3, Paragraph I. While this act does not amend the penal law on abortion, the government shall ensure that all women needing care for post-abortion complications shall be treated and counseled in a humane, non-judgmental, and compassionate manner.
Yes, Mr. President.
What actually struck me is why the need to put this in law. Isn't this a given that if people need medical attention, they always should be given medical attention, because a malicious mind can actually interpret this as the opening, an encouragement for the left hand to do what the right hand cannot do. My point is, if there is an insurance that in case of complications from abortion, government will come in and save you, then wouldn't the desire or or the complacency in getting an abortion, although it's illegal, be strengthened? Because anyway, the government will be there in case of post-abortion complications. So, actually, Madam Sponsor, this is what really struck me on my first reading of the bill. Why the need? Yun ang point ko, why the need?
Mr. President, we are extremely happy to respond to that question. This question has come up, I believe, in the interpellation of either the Majority Floor Leader or the Senate President. And we have an explanation for this, Mr. President. As His Honor...
Yes, ma'am.
As His Honor himself has pointed out, why do you need to put a provision here that assures a woman of post-abortion, a woman who is in need of post-abortion services, no? A woman who has post-abortion complications.
Yes.
Why would you have to put in the bill that she must receive humane, non-judgmental, and compassionate manner? Hindi ba obvious yun? That is His Honor's question. You know, Mr. President, I wish that was the case. I wish we did not have to put this here. But I would be very happy to present to His Honor medical professionals, women organizations, women who have made the mistake and the painful decision to commit an abortion, and they did not receive humane, non-judgmental, and compassionate care. Nangyayari po yun because, Mr. President, you have to recognize that we do live in an environment where we are against abortion, di ba? So in the same way po, if there was a pedophile, at alam natin may ginawa siyang kalaswaan sa isang bata, kahit ako po, baka hindi ko mapigilang sipain yun, suntukin yun, patayin yun, hindi ba? But the law requires that I deal with this suspect in a humane way. But my tendency would be to kill this person. And thus, I can imagine that professionals, even medical professionals, from doctors to nurses, would tend to have that tendency to deal with them in an inhumane way, or sometimes kahit sa salita lang po. That can happen kasi po, naiinis tayo na kagawa ang babae niya ng ganyang kasamang bagay. That is why we have to tell these professionals. In fact, there are even ethical classes in other countries, I believe. I don't know if it happens here, where they teach them how to deal compassionately with suspects of heinous crimes, with cases like this. Kaya po nandyan yan. And I give my assurance, as I have when this was raised earlier, that this is not intended to pave the way for abortion.
But do you see the danger, Madam Sponsor, that this could give the impression that...
But yes.
Go ahead. Even though it's illegal, go ahead. In case of complications, the government will be there.
Ang nakalagay po dito, and His Honor is a lawyer like me, ang nakalagay po dito, maliwanag po that the government shall ensure that women who are in need of these services shall be treated and counseled in a humane, non-judgmental, and compassionate manner.
Yeah,
we do not read into the
it's
law,
very specific for post-abortion complications.
But Mr. President, ibig sabihin nga, na-abort na po. Wala pong nakalagay dito na tutulungan silang mag-abort. Ang government will give the abortion. No, it is just giving them the compassionate care. Mr. President, if I may, Mr. President, if I may just use as an analogy, we passed the anti-torture law. Bakit ho natin pinasa ang batas na yan? Hindi ho ba yung anti-torture law, that law was passed because there have been so many cases that suspects of various crimes, I think mostly political crimes, are tortured in their cells. It would be easy to say that given yan, they are in the custody of respectable law enforcers, they will not be tortured. They will be treated humanely. But no, we had to debate and we had to pass an anti-torture law to protect the suspects, and sometimes hindi na nga suspects, sigurado na natin talagang may mga kasalanan gawa. We had to pass a law to be sure that law enforcers treat them humanely. It is the same thing, Mr. President.
Madam President, maybe we were creating a special crime, providing graver consequences. It's just like electoral sabotage. there's already election offense, but we created a special kind of election offense called electoral sabotage, providing for graver consequences. But in this particular case, this is part of guiding principles for implementation. We are not defining any new crime or providing any new standard. We are just restating what is already implied or should already be obvious, at the risk of giving the impression that government is there, so the left hand can do what the right hand cannot do.
Hindi po, we have a law.
I know, but are we willing to risk that? You know, that's my point. I mean,
no, Mr. President, I will accept any amendments that will ensure that that is not the implication, because ako po, I'm a humble lawyer. I've read this to many people who are not lawyers, and wala akong deception dito. It clearly just says that nagbibigay lang ng post-abortive complication humane care. Now, our debate itself is already the cue to DOH and all health officials that we are not allowing abortion here. In fact, if His Honor feels that the wording is too soft, yung sinasabi na yung statement na while this act does not amend, tanggalin mo yung while. This act does not amend. Whatever His Honor would prefer. And to further illustrate the commonality of this incident, one of my staff members actually has a Japanese doctor who does pro bono work here. She suffered a miscarriage, Mr. President, while she was here doing pro bono work in our country. When she went to the hospital, kasi po, I've had a miscarriage, and you still have to go to the hospital. They still have to check if you need DNC? They need a DNC. Or whatever, you know, because baka mag-internal bleeding ka pa or whatever. She went to the hospital, and they refused treating her. They refused to treat her in any way because akala nila nagpa-abort siya. But that is not their call to make. Whether she had an abortion or a miscarriage, whatever it was, they are supposed to give care. Right. So this is what this lady, Mr. President, who had an abortion, and I'll tell you how difficult it is. I had a miscarriage in the US. It's emotionally, it's physically painful. This woman had to fly back to Japan to get medical attention because our country refused to give a woman who lost her child unintentionally. And that is why I put a provision here to ensure, what if that happened to me? What if that happens to my daughters? When the time comes that they get pregnant, and sabihin sa kanila na, ay, mukhang abortion yan. Because, Mr. President, and I'll ask the doctors here, can you automatically tell if it was a spontaneous or an induced abortion? No. But if now people who are innocent are judged and treated badly, what more those who really did make the mistake of having an abortion? I don't think any of us would say that they don't deserve humane care. What His Honor's concern is that it is not misinterpreted. I think we agree on that. Yes,
Madam President. I'm just giving you one possible misinterpretation or a wrong message being sent by this particular provision, which, in my opinion, is actually not necessary anymore for the bill.
But based on the example I gave His Honor, would he not say that it is necessary because people do treat women with disdain, with disgust, and refuse treatment because akala nila nagpa-abort, and whether or not nagpa-abort, they deserve the treatment.
That's wrong. That's wrong treatment. And actually, even if we put the 3I, it does not. I don't think it will cure the situation unless we prosecute those who violate the law, because they're already violating some rights there even without the passage of this law.
Well,
those rights are already existing as of now. In my opinion. Anyway, Madam President, that is the possible interpretation, although it's wrong. But then the problem is when people read the law, let's say years from now, this becomes law, and they will read the law. They will read the provisions of the law. They will have no access to our discussion today and to the debate. So that's the reality. So I'm just pointing out the danger anyway. Thank you very much for your time.
So, Madam
Thank you,
President.
Senator Pimentel.
Thank you. Madam President, to continue.
Before the continuation of Senator Sotto's interpellation,
This is related to what
yes.
Senator Pimentel
May the chair
pointed
be
out.
clarified on the point of Senator Pimentel with permission of Senator Soto?
He was apprehensive about Section 3.
Yes,
Which we
I have a
mentioned
follow-up
before.
question before Senator Soto, if the sponsor would wish to clarify. The sponsor earlier mentioned that there were instances when doctors in the Philippines refused to provide care to women who had spontaneous abortion. Is that correct?
Sorry, I thought there was a clarification. I'm sorry, Madam. Could
Yes.
you please repeat your question?
The question of Senator Pimentel earlier was regarding abortion. And I heard the sponsor say that there were instances in the Philippines where our own medical doctors refused to treat
Yes.
women who had
Many
spontaneous
instances, Madam.
abortion.
Yes. Would you like me to elaborate on that?
May we
Is that your
know in
question?
what medical institutions these are and on what basis the doctors refuse to give medical care to these women, whether Filipinas or foreigners? Because the chair does not believe that the doctors will be, our former DOH secretary is here, doctors who would provide care to a woman who has had abortion, whether induced or spontaneous, will not be charged with a crime. If a woman's life is in danger and a doctor refuses to assist a woman because she has had an abortion, he will not be accused of any crime.
Okay, one of the particular circumstances that commonly happens, Mr. President, is that when a woman comes there with a suspected abortion, it is viewed as a non-emergency, and therefore many government hospitals turn them away and tell them that they have to go to private hospitals. When in fact, without the proper, proper inspection, what's the word? Examination. Without the proper examination, you would not know. And so some of these women bleed to death.
When a woman is bleeding, do you actually have factual evidence that a woman was bleeding and a government hospital refused treatment or to consider her case an emergency case even if she was bleeding to death?
Madam President, marami pong ganyan. Marami. And I will... there's too many. You can't even single it out. It happens out. Now, the question of Her Honor as to bleeding to death, again, personal experience. I had a miscarriage. You're continually bleeding. Now, whether you're at the point
I
of
had a miscarriage too, I know what you mean.
Yeah, so I wouldn't know. I mean, from my experience, I wasn't bleeding enough for me to fear for my life. But I was sitting there for a few hours waiting to be attended to by the physician, although the nurses were coming in and out. So I knew I was being attended to. Can you imagine? Her Honor is not unfamiliar with public hospitals. Many cases go unattended. Yung dengue nga ho, napapauwi, hindi ho ba? Marami tayong ganyan, ano? This is not an isolated case of neglect for women with post-abortion complications. The fact remains that this happens to women and there's a particular stigma. For example, Madam President, in the emergency room, there are 30 people waiting. May batang hindi makahinga, may asthma, merong suspected of dengue. Napapabayaan po yung suspected na nagpa-abort. Natural po yan eh, kumbaga sa killer. And forgive me for making light of this, but I'm a fan of Grey's Anatomy. The doctors there had a dilemma. They did not want to treat in their OR. There was like a mass shootout, and the doctors had a dilemma because the shooter was occupying one OR, and they really would prefer to bump him off and bring in the victims. I guess human nature naman po yun, ano? We would tend to, of course, tend to the victims rather than a perpetrator of a crime. So that is why lang po, we have to put it in this measure na tao pa rin yan. They deserve humane care. That is all we're trying to say.
Yes, same goes with a bank robber, Madam President. We don't need to put that in the revised penal code that the bank robber who is shot by the police, pag dinala sa ospital, dapat asikasuhin. Aasikasuhin at aasikasuhin.
Mr.
But nevertheless,
Mr. President, so, no, I need to reply to that. That is why we have the anti-torture law. Precisely because, Mr. President, suspected criminals are beaten up and are tortured when they are in the confines of law officials. That is why the legislative body deemed it necessary to say, no, you cannot do this to these people even though they are criminals.
Correct.
The same thing po. So His Honor is incorrect. I'm sorry to say that it is not necessary, because if we can do it for a common criminal and tell, we have to state, do not harm this criminal. We have to say it for a woman too. Why will we not say it for a woman and yet we will pass a law to say it for an average criminal? Why?
Okay.
Why?
We should not. We should not. That's why I'm about to go to that particular portion, Madam President. The distinguished sponsor mentioned miscarriages and missed abortions. At the proper time, I will tell you of my wife and my personal experience. Probably I'll do it during the turno and contra. And the experiences that you have undergone will not even compare to half of what we underwent. But now it's not the proper time to do that. I will do that at the proper time. Let me just now bolster the apprehension of Senator Pimentel on why he is apprehensive on Section 3.
Before that, the Chair would wish for a 1-minute suspension.
In March 5, 2004, entitled Kofi Annan Calls Abortion Group Shining Example for World. It stated, UN Secretary General Kofi Annan received an award from the International Women's Health Coalition, IWHC, a group working for worldwide abortion on demand for women and girls. Annan's enthusiastic acceptance of the award raises renewed questions about the objectivity of Annan and the UN Secretariat in general, which is responsible for organizing major conferences, international social policies. What is the relation to what Senator Pimentel brought up here? In his acceptance speech, the Secretary General lauded IWHE, saying that, quote, I am moved that you have chosen to honor me this evening. Above all, I want to pay tribute to the International Women's Health Coalition for the work it is doing around the globe. The IWHC and its partners provide indispensable leadership for the health and rights of girls and women worldwide. If there were more pioneers like you, the world would be a better place. You are a shining example. Now here's the bad part. This leadership includes teaching abortion advocates how to skirt restrictive abortion laws. Let me repeat that. Their leadership includes teaching abortion advocates how to skirt restrictive abortion laws. For instance, where legal abortion is restricted to those abortions considered necessary to save the life of the mother, IWHC recommends that abortion providers simply, quote, adopt a broader definition of what constitutes a threat to a woman's life by considering the risk of death if she seeks a clandestine procedure, end of quote. The IWHC also works for the radical reinterpretation of UN human rights documents. IWHC admits that no UN document explicitly asserts a woman's right to abortion, but despite these qualifications, the conference documents and human rights instruments, if broadly interpreted and skillfully argued, can be very useful tools in efforts to expand access to safe abortion. For instance, according to IWHC, the right to life, the first right enumerated in the Universal Declaration of Human Rights, should include a right to abortion, since women who seek illegal abortions risk their lives. UN Secretary General Ban Ki-moon also supports and says practically the same thing, Madam President. So it raises the apprehension and that is a point that Senator Pimentel brought up. They will push for ways of skirting the actual endorsement of abortion, because there are countries that declare abortion as illegal. If I gave Senator Pimentel a broader perspective, I hope he would look into the statements made by the United Nations officials, President. Now, before I move on to let me just submit to the records also of the Senate other quotes from books about Miss Margaret Sanger. Ilag sila ng ilag kay Sanger, but Senator Santiago actually said good words about her. And the letter of the FPOP addressed to the media attacking me praised Margaret Sanger. So, just to continue and finish this particular portion of my discussion.
Please continue. I'll just put on record that it has no relevance to the bill, because Margaret Sanger and the organization she founded has no place in the bill. But by all means, please continue.
Yes. In The Women and the New Race, Margaret Sanger, as I mentioned earlier, said the most merciful thing that a large family does to one of its infant members is to kill it. Now, on blacks, immigrants, and indigents, she's quoted to have said, human weeds, reckless breeders, spawning human beings who never should have been born. This is found in Pivot of Civilization, referring to immigrants and poor people. And also her statements on sterilization and racial purification, on the right of married couples to bear children, on the purpose of birth control. The purpose in promoting birth control was to create a race of thoroughbreds, she wrote in Birth Control Review. More children from the fit, less from the unfit. That is the chief aim of birth control. Birth Control Review also, page 12. On religious convictions regarding sex outside marriage, this was what the President Pro Tem was interested in earlier. Quote, this book aims to answer the needs expressed in thousands on thousands of letters to me in the solution of marriage problems. Knowledge of sex truths, frankly and plainly presented, cannot possibly injure healthy, normal young minds. Concealment, suppression, futile attempts to veil the unveilable. These work injury as they seldom succeed and only render those who indulge in them ridiculous. For myself, I have full confidence in the cleanliness, the open-mindedness, the promise of the younger generation. Happiness in marriage. She has also statements on the extermination of blacks, on respecting the rights of the mentally ill. She said compulsory sterilization. On adultery, a woman's physical satisfaction was more important than any marriage vow. Also found on page 11, birth control in America. On marital sex, yeah, I read that already earlier. So her goal in life, according to her, an autobiography, page 194, Sanger admitted her entire life's purpose was to promote birth control. This is the founder of the IPPF. The IPPF is the #1 supporter of the FPOP. The FPOP is a partner of the Department of Health, receiving funding from the International Planned Parenthood Federation. That is what they claim.
Mr. President, just to put on record, DOH is here and they tell me they are not a partner.
It's found in their website. DOH website. The DOH said that they are not partners?
They are
Is Secretary Ona here?
They are stakeholders, Mr. President. Sec Ona is actually coming. We can get clarification from them.
Well, and yeah, you can do that, the President. As I said, they are connected. Now, now that I have already discussed the influence of the founder, let me proceed to my discussion on how the IPPF promotes abortion around the world.
Mr. President, if I may, IPPF, I've put this on record earlier, so just let me make a quick clarificatory statement. Abortion is a common topic discussed in many international organizations, particularly women's organizations. And thus the statements earlier by the discussion on abortions by the United Nations and by the IPF is something that we need to recognize happens all over the world. And it is not prohibited in those parts of the world, and neither is it prohibited to discuss here. But again, as His Honor will go through the position or views of IPPF, let me just reiterate that abortion is not allowed in our country, and therefore any view that IPPF expresses in other countries is not relevant to our country, Mr. President. And having said that, His Honor may proceed. Thank you.
April 18, 1996, the Population Research Institute, PRI, published a report detailing the involvement of the IPPF in promoting and performing abortion throughout the developing world. The original IPPF mission was the initiation and support of family planning services throughout the world. Over the last 15 years, the IPPF has become increasingly unwilling to be perceived as a pure population control organization and has thus recently emphasized such principles as responsible parenthood and the health of families and young people. Despite this apparent moderation of its stance, no other organization has done more to spread abortion throughout the world than the IPPF. Not satisfied to rest on its laurels, the IPPF has forcefully and repeatedly stated its intention to assist in the legalization of abortion in every country of the world, regardless of the means used, and has also voiced its willingness to set up and equip abortion centers and provide the expertise required to perform abortions on a massive scale. In its Vision 2000 document, which is considered to be the marching orders of all members family planning associations. These include the Family Planning Organization, Family Planning Office of the Philippines. The IPPF repeatedly and unambiguously calls for legislation of abortion in countries where the procedure is currently unlawful. In the summary of IPPF's Mauritius Conference, it issues guidelines on how member organizations can agitate for abortion law liberalization. And once abortion is legal, participate in the performance of the procedures. Where abortion is illegal, all family planning organizations could take up test cases to pressurize for more liberal interpretation of some legislation. Liaise with sympathetic legal professionals to develop clear guidelines for health workers on the ways in which the law can be interpreted. The IPPF does not merely talk about breaking the law, it is engaged in massive ongoing violations. The IPPF has been promoting and enabling illegal abortion in the Philippines for at least 20 years and has been providing large numbers of large number of abortion machines to numerous developing countries, including Bangladesh, Korea, Singapore, Hong Kong, Thailand, Vietnam, and India. The Hastings Center report article shows how the IPPF assists groups in circumventing the laws of developing countries while systematically covering up such activities. The article reads, quote, "In the Philippines, where abortion is both illegal and explicitly against official population policy, the IPPF provided 200 menstrual regulation, first trimester abortion kits, and menstrual regulation kits for demonstration purposes. Further controversy arose when the FPOP, the IPPF affiliate, the Family Planning Organization of the Philippines, distributed menstrual regulation kits to local doctors. Although the government had laws specifically prohibiting the importation of abortive devices, these kits were brought into the country as medical instruments to obtain sample tissue for examination. These examples show the potential of the IPPF and its collaborating organizations for circumventing national laws and policies. Yes. And we have records, documents to show. We will submit it to the records, for the records also, that the DOH has received they also received such from the IPPF. Submit this to the records. Now, what are the deceptive tactics of this International Planned Parenthood Federation? Deceptive tactic number one. Their claim, the use of contraceptives lowers the number of abortions. That's the claim. On the surface, this claim appears to be reasonable. It seems obvious that if one uses some type of birth control when engaging in sexual intercourse, one will be less likely to get pregnant than if one used no means of birth control. So the general public believes IPPF's claim and sees the distribution of contraceptives as part of the solution to the abortion problem. Yet, there are a number of studies and facts which have become known over the last 50 years that casts a large cloud of doubt over the Planned Parenthood's claim. Facts would show, number one, study by Regine Stix, which included data that showed 635 pregnancies of 1,633 persons who were using contraceptives were aborted, while only 50 pregnancies of 1,438 non-contraceptives were aborted. Stix wrote that nearly 40% of the accidental pregnancies experienced while contraceptives were being used were terminated by illegal abortion, while less than 4% of these pregnancies experienced when no contraceptives were used were terminated. Raymond Pearl, a Johns Hopkins professor and noted authority, also wrote, those who practice contraception as part of their sex life, by their own admission, resort to criminally induced abortions about 3 times as often as proportionately as do their comparable non-contraceptor contemporaries. In Great Britain, a report prepared by the Royal Commission on Population found that the incidence of induced abortion as a percentage of all pregnancies was 9 times higher for women using contraceptives than for women not using birth control. A Japanese report also documents a guidance program in contraception that involved 2,230 couples. The program was aimed at teaching these couples how to use contraception. The program resulted in significant increases in induced abortions per 100 wives, from 6.3 the year before the program to 9.2 in its first year of operation. If birth control offers some protection, how can its use result in more abortions? So the answer lies in human nature. If engaging in sexual intercourse is perceived as entailing a great risk of unplanned pregnancy, men and women will avoid the activity. Of course, some will still do it and some of them will get pregnant, but many will consider the risk too high and will refrain from sexual intercourse. If, however, you tell these people that you have a way of taking away the risk of an unplanned pregnancy and provide them with instructions on how to use the devices you provide, you will have taken away one of the major reasons people avoid sexual intercourse. Thus, relieved of the worry, of course, about unplanned pregnancy, the country will engage in intercourse more freely, assured that birth control devices will protect them. Couples who previously had intercourse once or twice a month will feel comfortable having once or twice a week. Other couples who have stayed clear of the activity altogether will not fear engaging in sex. Well, the result of this freedom will be a tremendous increase in the number of times couples engage in sexual intercourse. Some like that, but since all the birth control devices have a failure rate which varies from 5% to almost 50%, this increased activity will result in an increased number of failures, and each birth control failure will be recorded as an unplanned pregnancy. So, the claim is deceptive. Now, another deceptive tactic that they had is menstrual regulation. The IUD, Norplant, depo-provera, and the low-dose and mini birth control pills are not abortive agents. IPPF goes out of its way to assure individuals that it is not a pro-abortion group. It claims to be working to reduce the number of abortions by providing birth control. But there is another side to this birth control issue that IPPF hopes you will never find out. That is the fact that most of the devices distributed in family planning programs and called contraceptives do not really prevent conception. To avoid arguments on the issue on whether contraceptives are abortive agents or not, in the late 1960s, IPPF and its affiliates got some medical associations to define a pregnancy as beginning at implantation and not conception. IPPF, WHR, now uses this technical distinction and maintains that since the devices referred to above prevent implantation, then an abortion has not happened because there never was a pregnancy. IPPF uses the same semantic game to tell the users of these devices, these devices, they prevent you from getting pregnant. The truth is, the IUD, low dose and mini birth control pills, depo-provera, Norplant, and the morning after pills cause the death of a unique human being during its first week of existence. They are not contraceptives. They are instruments of death, Madam President. That is their deceptive tactic number two. They have also another deceptive tactic. Deceptive tactic number 3. Family planning programs save money. They made computations, but they did not include computations that fertility rate falls below. Let me start with their claim that providing family planning programs actually saves money. The Alan Guttmacher Institute, mentioned earlier here on the floor, the research arm of the IPPF, published a report claiming to show that every US dollar spent on family planning program saves $4.40 in later costs for government programs, such as programs for the poor, providing food and shelter for needy children, etc. The report basically estimated the number of children who would not obtain welfare and other government assistance because they had not been born. Thus, it claims savings for each child not born. The PPF uses this data to convince government to spend money on family planning programs. The problem with the Guttmacher study is that it assumes there will be no change in the frequency of sexual intercourse before and after providing family planning services. The study assumes that after you give people, even teenagers, education on birth control devices and makes these devices available to them, they will have sex as frequently as they did before. Well, with the increase in sexual activity comes a corresponding increase in abortions, sexually transmitted diseases, and other health problems. The costs of treating these problems was not included in the Guttmacher cost analysis. Also not included is the fact that once the fertility rate falls below 2, our country will have an aging population. There will be fewer new taxpayers and higher costs for taking care of the elderly. These costs, like all mentioned above, are simply ignored by the Guttmacher study. The study doesn't take into account the well-known fact that actions have consequences. You cannot interfere with natural bodily processes by artificial means and expect healthy results. There is another deceptive tactic, but this has been overly discussed already. They say the world has an overpopulation problem. Look at the statistics and look at how big the world is. With their various programs, they seek to address the world's overpopulation problem. Well, I will just submit these statistics to the Senate. These people think they're smarter than God. Ala nila gagawa ang Diyos ng mapupuno ang mundo eh. It's impossible. Mexico, Peru, Venezuela, United States, just in the state of Texas, lahat itong mga binanggit ko na to, even the province of Alberta, all these places, pag pinagsama-sama po lahat ng tao sa mundo, kasya dyan. Hindi nakatayo ng diretso ha. May kanya-kanyang lote, may kanya-kanyang bahay. We will just merely be a speck in the world, putting all the population of the world together. But we have discussed that a number of times already before. Let me just submit for the records also these statistics. Let me go to deceptive tactic number 5. They say sex education reduces teen pregnancies. IPPF promotes sex education as a means of reducing teen pregnancies. That is a lie. In over 25 years of sex education in the United States, IPPF has yet to produce documentation of any reduction of teen pregnancies due to sex education programs. In fact, one of IPPF's allies, the New York Civil Liberties Union, says, I quote, "Every scientific study that has been done shows that sex education is correlated to nothing else but systematically increased use of abortion. Thus, the only result of sex education, Madam President, is to sell more birth control products." May I remind the body also that the main sponsor of the IPPF is the group called the DKT. It's a corporation. It's an international corporation, the largest corporation producing condoms and contraceptives, Madam President. This group, the IPPF, works with groups who provide funding for many projects in developing nations. They have affiliates in the United States and Canada, develop joint programs with the United States agencies.